Good morning, everyone. Wasn't yesterday great? Seeing all the learning, the collaborating, and the reconnecting, it was truly amazing. But for me, nothing was better than the puppies. Who got to see a puppy? Did anybody adopt one? All right, truly it's a privilege to be here. I love this time because I love having the opportunity to share with all of you our progress and our thinking. So this morning, let me start with an observation. Healthcare is not short on data. It's short on time, capacity, and clarity. Every day, extraordinary clinicians and leaders are asked to do more. With tighter margins, fewer people, rising expectations from patients, families, regulators, and staff, and too often, we ask them to spend the precious time they have searching for insight instead of acting on it. And that's why today is a conversation about technology. It's a conversation really about leadership and how AI can help us move from insight to action. We've all seen the data. Healthcare delivery in the United States consumes nearly 20% of GDP. Costs continue to rise faster than inflation, faster than wages, and more than 60% of total healthcare cost is labor-related. Not because people are inefficient, but because humans are doing the work that machines can now do better. Reading thousands of comments, writing summaries and reports, tracking follow-ups, monitoring whether actions worked. For the first time, AI gives us a real opportunity to reduce the cost of healthcare delivery without compromise, while improving care quality and the human experience. This is about removing friction. Across industries, and increasingly in healthcare, we're seeing consistent results. 50% of current work tasks are automatable by AI. Up to 90% reduction in content creation time, as much as a 10x improvement in customer response rates. These are not future promises. These are outcomes people are achieving today. The implication for healthcare is profound. AI gives us back capacity, the most constrained resource in all of our systems. And things are moving fast, and at times it may feel like a race. But this is not a technology race. It's a leadership one. At Ganey, we think about AI through four big themes: summarize, compose, recommend, and act. Let me start with the first AI theme, summarize. Healthcare generates oceans of data. Surveys, comments, safety events, rounding notes, call transcripts. In fact, a study recently cited in the New York Times, cleverly titled, "Call Me Dr. Ishmael," shared that 1 in 5 patients have a medical record longer than Moby Dick. And if it's been a while since you've read it, it's a 600-page, 200,000-word novel. AI's first superpower is simple and transformative. It answers the question, what do I need to know? Not a PowerPoint, not a spreadsheet, just a clear narrative. We're watching you use Narrative HX, our AI-powered text analytics tool, to bring this to life. At Henry Ford in Detroit, teams are using Narrative HX to analyze experience data, digital patient feedback, employee experience, and major organizational moments. From IVR to MyChart, they're able to understand sentiment and themes that give clear insight to drive rich feedback. At Freighter in Wisconsin, Narrative HX is being used not only with standard patient surveys, but with custom surveys and operational data that weren't previously easy to analyze. Nurse triage information, scheduling interactions, and even talent acquisition feedback are being used to drive action. The second AI theme is compose. Insights only matter if they can be communicated. Our AI now helps leaders to create clear executive summaries, translate insight into clear action plans, and align teams around a shared story. This is how insight becomes leadership communication. It's especially powerful when leveraged on the front lines of care. Adventist Health in California is using AI to compose feedback to frontline teams and generate action plans, saving time and promoting learning. At Prisma Health in Greenville, Dr. Jonathan Gleason and his amazing team have built the clinical operating system that simplifies and standardizes daily work for frontline teams while supporting continuous improvement. We're pretty excited to partner with them to scale this solution across organizations in healthcare. The third theme is recommend. AI doesn't just explain what happened, it defines and identifies what matters and what doesn't. It surfaces interventions that correlate with improvement. It helps leaders focus attention where it will have the greatest impact. And that focus is everything. Dashboards helped us measure, but they were never designed to help us lead. Let me tell you a quick story. As Pat mentioned, I spent almost 20 years as an executive at a major health system. Many of my meetings, I think, seem to follow this same pattern. First, we got into the room and we opened the dashboard. Actually, we probably tried to figure out the AV first, but eventually, we got the dashboard working, and everyone would lean forward and very seriously study the screen. Someone would say, "Can you filter that by service line?" And maybe somebody else would say, "That's not the dashboard I was looking at last week." And then suddenly, the specter of, "Is this the right data?" would get raised. The conversation would ensue, and pretty soon, the time was up. No decision was made, but we all agreed the colors were very interesting. Dashboards were progress. They helped us measure, benchmark, and compare, but somewhere along the way, we started confusing access to data with clarity. AI did not enter healthcare because we lack information. It entered because we lack time. The future is not static, it's conversation. With AI, leaders can now ask the data, why did experience change? Where is risk emerging? What should we do next? And they can receive answers grounded in evidence, context, and expertise. And this is exactly what we're doing with our product called Chat with Data. When we introduced Chat with Data last year, it was early, the idea was clear, but the technology was still emerging. I'm happy to share that starting next month, we'll be rolling out Chat with Data within our PX model system dashboards, bringing conversational insight into the daily workflow leaders already rely on. Tools like Chat with Data represent a shift towards a more natural way of engaging with information. Instead of navigating reports, leaders ask questions, and they follow the story the data is telling, in real time and in context. What makes this possible is the emergence of AI agents working together behind the scenes. Rather than relying on a single model, these systems combine different forms of intelligence, interpreting structured data, making sense of unstructured feedback, realizing and recognizing emerging patterns, and grounding responses in evidence and best practice. This approach changes what leaders can expect from data. It's no longer limited to explaining what happened. It can now help leaders understand where momentum is building, where risk might be emerging, and what deserves our attention next. We're seeing this most clearly as our predictive models trained on Ganey's data set surface emerging signals months earlier than traditional reporting ever could. And we're not stopping there. We're digging even deeper. At Houston Methodist, we enhanced our predictive HCAHPS work by testing additional signals such as unplanned admissions and NPO status. And because these conversations are grounded in evidence and context, they don't simply stop at explanation. They support judgment and inform our decisions. They're acting as our trusted advisor. And while summarize, compose, and recommend, all themes we introduced to you last year have taken us far, today, I want to focus on our fourth AI theme, and one that represents our most important shift forward: act. This is where AI moves from insight to action. Our Agentic AI can route issues to the right leader, trigger workflows automatically, monitor outcomes over time, close the loop without added burden. Not more work, less friction. Our predictive agent explains what's happened and tells you what's coming. By leveraging the PG dataset, our agent can tell you where important measures like likelihood to recommend are heading months in advance, creating ample time for you to adapt. Summarize, compose, recommend, act. Each an amazing AI capability on their own, but supercharged when we combine them together. And nowhere is this better exemplified than what we're doing with ambient rounding. When documentation fades in the background, attention returns to the patient. Ambient rounding summarizes, reports, identifies risk, and triggers action. This is AI being your system of action, not your system of record. Ambient technology captures authentic signals in the moment through our conversations and our workflows that are already happening. We're especially grateful to partners like Nebraska Medical Center, who were the first to participate in live user testing with us, validating that what we saw in our labs was even better in the field. Instead of relying solely on surveys that provide us high-fidelity information, the future is fewer interruptions and richer signal. Ambient rounding captures insights in the moment, continuously and contextually. Look, AI is everywhere. It's splashed across headlines, it's in our news feeds, and somehow showing up in what seems like every conversation, whether we ask for it or not. If you make it through a dinner party, a meeting, or an Uber ride without hearing AI, congratulations, you've probably achieved something rare. And maybe next time, if you don't want to talk about AI to your Uber driver, take a Waymo. Big tech companies and startups are investing billions. We've all seen the news. Big tech is building infrastructure and platforms at scale, unbelievably powerful models, new tools, and entirely new ecosystems. While startups are bringing speed, focus, and new capital. And together, they are changing how technology works and how every industry operates. And this is why we're especially excited to see Ganey and Qualtrics come together. Ganey brings deep healthcare expertise, benchmarks, and trust. This combination will accelerate our ability to provide human experience at scale. It'll help us accelerate innovation as we stay ahead of what's next. 2025 marked Ganey's 40-year anniversary. From pioneering the development of patient experience measurement with you, to our evolution into the broader human experience platform we are today. We understand the value of industry expertise. And this is why, at the end of the day, we are embracing AI. AI does not create expertise, it amplifies it. The winners will be organizations with deep domain experience, trusted data, proven operating models. Sound familiar? It should, because this describes all of you in this room. The differentiator will not be who has AI, it'll be who uses it wisely. All right, let me close by returning to my opening observation. Healthcare does not have a data problem. We have a, what do we do with all this data problem? We're drowning in information and starving for action. And look, I love data, but if data improved healthcare on its own, we would have solved everything by now. The future is different. The future listens and gathers while things are happening. The future is surfaced insights and automated action. And despite all the doom and gloom headlines, AI does not want your job. It wants your documentation, it wants your reporting, it wants your complex follow-up tracking, it wants that weird 19-step workflow. Frankly, AI loves the work we hate. And when it takes that work, something magical happens. We get time back. Work gets calmer. There was a time when we worried that if we listened at scale, we'd create a new problem, too much feedback. AI has changed that too. AI can now tell the difference between a patient telling us the coffee was cold and I didn't understand my discharge medications. AI knows to trigger immediate clinical action for the medication. This is not just listening. It's using AI to act at scale. Our vision is AI that helps nurses prepare conversations and helps patients feel heard and safe. The kind of AI that disappears to the background. And that's kind of the point. The best feedback we got when we trialed ambient rounding was, I forgot it was even there. And I think that's when you know technology is really working. Here's the big shift. Insight alone is no longer impressive. Action is. If your system still relies on someone noticing a problem, emailing a spreadsheet, scheduling a meeting, counting on someone to follow up, you're not alone. But the future is systems that see problems, route them, fix them, check if they work, all without heroic effort. No chasing, no escalation theater, no follow-up emails. Leaders stop reacting, teams stop firefighting, and patients stop feeling like they're navigating a maze. Work feels manageable again, which frankly is revolutionary. So here's my prediction. There'll be two kinds of organizations going forward. Those who say, we have great data, and those who say, we act on it. And yes, the gap between the two will get obvious very quickly. So here's our invitation to you. Don't just measure human experience, use it. Don't just listen, respond. Don't just adopt our AI, put it to work. Because the future of healthcare will not be built by the organizations with the most tools. It'll be built by the ones who made work easier for the people doing it. And when we do this right, no one is going to say, wow, AI changed healthcare. They'll say, the work feels calmer. Care is safer. The human experience feels better. And honestly, that's always been our shared purpose. Thank you.